Generally, women are more prone to UTIs because of the short urethral length, and also our urethra tends to sit very near to the bowel entrance. Hi, I'm Dr. Gaik 𝗚𝗍𝗶𝗶. I'm an obstetrician, gynecologist and urogynecologist at 𝗧𝗏 Medical Center. A urinary tract infection is a condition whereby microorganisms, namely bacteria, can ascend and grow in the urinary tract. So when ladies experience a UTI, they can feel a burning, painful sensation when they try to pass urine. The urine can appear cloudy, there can be blood in the urine, there can be a bad smell of the urine as well. And some ladies will experience lower tummy pains or even back pain. Well, it is not always possible to predict whether a UTI episode will resolve on its own. Without treatment, the UTI symptoms can last even up to 1 week, and most of the time antibiotics are necessary. It's important to see your doctor early to run some urine tests and start treatment so that the infection does not get any worse. Also, if the symptoms of UTI persist even after the UTI episode has been treated, we might want to seek a gynecology opinion so that other diagnoses such as urinary incontinence can be excluded and treated. Generally, women are more prone to UTIs because of the short urethral length, and also our urethra tends to sit very near to the bowel entrance. It doesn't necessarily mean that we get UTIs because of poor hygiene practices, but we do advocate certain good habits such as hand washing before going to the toilet and before wiping the vaginal area. Practice the habit of wiping from front to back. Also, avoid using vaginal douches or very strong or perfumed soaps. Washing with water is adequate, but if you do want to use a cleanser, use something mild and liquid soap. Try to have showers instead of having baths. So these are the few hygiene practices that might help reduce the incidence of UTIs. So in certain groups of women, particularly sexually active women, so some ladies tend to get a UTI episode after sexual intercourse. Some ways to prevent this is to try and empty the bladder before and after intercourse and avoid use of spermicides. The other group of ladies who are prone to UTIs are the women in menopause. The other good habit to have is to drink adequate amounts of water, so at least 1.5 to 2 liters of water a day, and try not to hold the bladder for many hours. In women with diabetes, it is important to control their blood sugars, otherwise this will make them prone to infection, so including the UTIs as well.